In cases of anemia or platelet dysfunction, the spleen can be treated very easily and effectively. The way to find the spleen notch, which is located on the left side of the rib cage, is to go right to the bottom of the lowest rib and trace your index finger till you come up to a palpable notch on the left side. And that would be named the splenic notch. And there is a special energy nerve center there which directly feeds into the spleen, which is very important for hemopoietic function. After having located the spleen point, I allow my thumb to sink into this region very lightly, but with the weight of my normal arm. And when I feel my thumb has gone in as deep as it can, I very gently make a right angle turn with my thumb. In normal circumstances, there would be a cord-like tissue thickening right there, which sometimes slips out of this notch. The intention of this treatment is to lift and reposition the feeding point for the spleen. We're talking about blood vessel feeding as well as an energetic feed. And once this right angle turn is executed, the spleen gets what it needs. Sometimes if you were to place your hand over the surface area of the spleen, you might encounter a kind of a warmth over there, in which case we take the heat off by draining the heat away by very simple stroking and drainage movements over the surface marking of the spleen. And to find where your hand should be, you place your little finger on the lowest rib cage and use your palm, rather like a windscreen wiper on a screen, gently sloping from the lateral aspect towards the center of the abdomen and across, just in this way, for 20 minutes to decongest the spleen. This is quite a useful treatment also in any cases of nausea during pregnancy. I'd like to demonstrate a very special point on the spine, which is also useful for feeding the spleen with the nerve force energy and the life force energy. We identify the splenic notch in the front of the body as the lovely lady was lying down. And now I go along with my left hand and I find that same spot again, and I trace the pathway along the rib all the way up to the midline, just along the spine to the midline, and then I perform very gentle breaking up movements, tiny quarter turns of my thumb, just in this region, right next to the spine, in the intercostal space, which relates to the nerve, which goes all the way down to the spleen point on the front of the abdomen. After having broken down the subcutaneous tissue and softening this zone, which might have a build-up of tissue fluids, which is somewhat blocking the energy flowing to the spleen, after having cleared it sufficiently, I follow the pathway of that nerve all the way down that rib, all the way down, following it, all the way down, all the way down towards the spleen point in the front of the chest cage. And then I would also stroke my thumb along that rib, making sure that I smooth out any thickenings, any collections of fluid, any pockets of fluid, smooth it out. And it's interesting to note that if there is a hold up and a build up of tissue fluids blocking the nerve pathway, this zone that I'm working on becomes slightly reddened in color, which shows that definitely this nerve needed to be cleared, this nerve pathway needed to be cleared. We can perform this once a week or so to improve the hemoglobin levels and also to normalize the blood profile.